I'm a trauma surgeon. I work at USA Health, and we have someone trained and ready to help injured patients all throughout the city, but really all throughout the Gulf Coast region. And when we think about gun violence, that is a significant portion of the patients that we see. For us, we are at 20 to 22%. So really double that of other large trauma centers across the country.
Became a licensed funeral director in Bond. One of the first cases of when I got licensed was seeing one of my middle school classmates from Booker T. Washington laying in front of me dead. This was going into some housing projects, and he was trying to get his best friend from upstairs. And the guys looked at him and said, "What you doing here?" And they just shot him completely dead.
We know what it is to be involved in gun violence. Most of us, as myself, stay in districts that have gun violence. And it's not because we're not educated or we're not smart, but we keep hearing talking about things on the panel and talking about this and that. So we want to know, what is the solution and why, if you're going to be putting, and you have to talk about money or resources to go back into our black district. Why would you put money into the black communities? We know where the gun violence is coming from. Put money in their programs.
Would the city council be open to fund, on the city level, be funding more after-school programs in Mobile schools, because that has statistically shown across the country to help bring down gun violence, as it gives students more sense of community, which desensitizes divisive action like gun violence.
You talk about the city. The city has a budget, and unfortunately, we have to live within that budget. Like I said, CJ is correct that they never said no, but we also have to live within what the city has, because we can't spend more than the city.
We're trying to address those type of issues. As far as programs, I'm sorry, I'm not ready. I don't know much about what's going on in after school care and things like that. We do have some programs through Boys and Girls Clubs and things like that. And actually, they use some of our campuses, try to get the kids involved in sports, things of that nature. But absolutely, any other programs or ideas, our school board again is open to figuring any ideas that we can get. Because again, we're doing what we can. 8 hours we're having today. A lot of times it's the after time that we need to do something to get them involved in something else or something productive.
So pretty much what we do at Break for the city of Mobilian PRD, we have a group of teens right here, raise your hand, youth advisors. Pretty much come to meet. We meet every Monday, and we come up with all new fun and safe programs and teaching against volunteering and endeavors, whether it's recreational or education. It's all over the place, I promise you. So that's pretty much what we do.
My name is Valerie Longa, and I'm the education director at Mobile Daykeeper. And I launched an after-school program this spring called Next Gen Daykeepers. We're programmatic partners with Parks and Rec. We've been working with the Harmon Community Center. And we are very fortunate to have some of the officers who are in the back. Unfortunately, this week, there was a shooting that took place on the front porch of Harmon Community Center, and the center was on lockdown for 2 hours. The children were traumatized from this event. They were not able to come to the program this week to participate as usual. I have found out that shootings near the center happened. There was another day that they were on lockdown due to a perpetrator that they were after in the neighborhood. And there needs to be more security and safety at the center at Harmon. These kids, we've built mentorship and a great relationship with them. They're fantastic children, and they deserve to go to a safe place. And the people who work there provide as safe of an environment as possible. There needs to be a plan in place where our safe places can remain safe.
So my question is, I gather for Dr. Williams, I think
during the time, I heard a lot of reference from many panelists about finding the root causes of violence. I think when you spoke, you addressed the risk factors, but I'm wondering what you learned about the actual root causes.
So our hospital-based violence intervention program is a concerted effort in getting it off the ground. We got funding from the city of Mobile, as well as the Mobile County Health Department, to be able to build this program. We got everyone hired on the team as of March, and we have in our program myself as the medical director. We have a project director, which is Josh Jones. Formerly, he was the violence prevention coordinator in the city. Brandon Batiste, who's here tonight, is a part of our team, who will be providing counseling and overseeing our violence intervention specialists. We have 3 of those. These specialists are being trained as community health workers through a 12-week program, as well as the training under the hobby. So they're getting 2 separate trainings. The purpose for the community health worker training, in addition to the hobby, is that we know it's not just about gun violence, right? When we meet patients at the bedside, when we meet their families at the bedside, we are going to, through our needs assessment and building those relationships, better understand what the risk factors or root causes are. And then the whole point is to put together a holistic package for that patient, for that family. We've identified several risk factors for our patients or needs, priority needs of our patients. One is transportation. Being able to get to and from these services is an issue. Another is food insecurity and housing. Those are 3 of the big ones. Of course, insurance and money for vital services, for medication. Those are 5 of the big things that we're seeing in our clinic population. But it's going to take each and every community-based organization, community members who specialize in certain things. So if it's Lifelines counseling, for mental health, if it's our pastors, creating a model to where we have church home bases. Yes, we want patients to be able to come back to their healthcare appointment, but we also need a place in the community that we can go when we don't have transportation, that we can walk to. So we're in Maysville. What if Revelation is one of those home bases? That we have these spiritual care, but also they be hubs or home bases is what we've been calling it in our building out of this program.
My question is, I hear the resources, I hear the programs, but can you share with me the comprehensive approach to addressing the risk factors using multiple agencies across the city? And when I ask that, I'm asking, is that something in the plan? Is there something already in works for that? If you could just give more information on the comprehensive approach to address the systemic issue as it relates to our conversation.
The health system doesn't have the capacity to provide all of the services that our patients will need. We definitely understand that. But yeah, it takes multiple agencies. And so as we build out this program, we have funding in order to provide our partners who are doing the work. So it's not just all funding coming to USA Health. We have funding for our community partners as well as unrestricted funds for our patients. So if our patients need wound care supplies, or if they need a copay for mental health services, or if they've been in the hospital and their lights are no longer on, we have funds to help patients with those needs.
You have kids majority of the day, and you have programs that deal with the trauma and the psychology of the kids. Why are you not implementing that, continuing the school system with known by parents? Now, if it's a school here, a school here, a school here, I mean, nobody's gonna know that. But majority of Mobilians, myself included, I don't know that. What are we doing like live action right now in the schools? Not programs, not things like gonna get a parents for, great, wonderful, whatever. That's great for what I classify as social mobility kids. But with the kids who are really in it, what are you doing? Are you circulating kids who actually been traumatized to go back and talk to kids who are in it?
If we get our kids at an early age, when they first start talking,
It's got to start at home, school, community, and the nation. And let them know what the history of this land is. The good, the bad, and raise them up like that. That's how I was raised. These kids aren't getting that. We nitpicking different things that we telling them. They need to have a sense of pride. So they'll know where they came from, what their ancestors had to put up with. Teach it to them. Teach them that history. Bring it back in school. Stand up, you educators, and let people know we gotta get our kids when they're small.
We've heard a lot of talk from the council tonight, and y'all say that the city doesn't have enough money. But the city has enough money for a new bridge, a new airport, for Mardi Gras, but the city doesn't have money for dead children. Why don't we take that money from the police department and put that into social workers, trained mental health counselors?
My concern is, like these last few people was talking about the school systems. We don't see supplies, books, things of that nature in the school. The teachers, they are not, I'm going to say, up to par. I volunteered, like I said, at Pathway. I had to go to the principal because I saw bullying from the teachers to the children. So we need to start with the education, like they're saying. Of course, the parents, they need to be involved as well. We're not going to put it all on the other people, but the parents need to stand up, even if it's being held accountable within the school system.
My question is, have you thought of a contingency plan to deter the amount of guns that are hitting our streets and our communities today?
This community gets money, but it's diverted. $304,000 annually is what the city of Mobile gives to the Boys and Girls Club. Then CJ Small give a little bit. And then the pancake breakfast gives some. Our children don't get much of that. Let's see a show of hands of the organizations that teach Black history. Can I see them? Okay, see that? Our children don't know where they're from, so they're confused. We got people that are recipients of grant monies for the children in this district, and it don't get to them.
Questions. This is mainly for the school board. So the first one is, with Mobile County being the largest county in Alabama, why do we have so few school resource officers, but we have a high number of schools and students in our county? The second question is, what training does Mobile County Public Schools currently provide to teachers regarding de-escalation strategies and behavior prevention? Teachers and educators in our district spend countless numbers of hours with these students that can be impactful. So how can we make these teachers more equipped to deal with the behaviors they're seeing and these signs that may show us that they may lead to behaviors and commit crimes in the future? How can teachers at the elementary level make more of an impact, and how is the county equipping them to be able to do so? Thank you.